So today we're going to try and demonstrate the improvement of the loss of volume that sometimes occurs along the orbital rim. As all of us get older, we lose volume, and it makes this area look a little bony and less full, which doesn't translate into youth. And in addition, it takes up some of the slack of a minimal amount of loose skin that occurs in some people's eyes. So we're going to mark now where we're going to put the filler. And we usually use Restylane or Rejuvenation because they're very forgiving, very safe, and they can be dissolved to some degree if there's any evidence of too much, although that's very rare. So we're simply going to fill along the bone on both sides of those marks, and the only access point, the only way we get there is just for a tiny dot of an incision right there, and we'll demonstrate that in a minute. To begin the process of injecting the Restylane along the orbital rim, the first thing, we've already made a small dose of local anesthetic there, so there's no pain with this. And any discomfort there at all? Do you feel anything?
Not really.
So we've made our pilot spot, and now we're going to take this out, and we'll insert our blunt, soft plastic tube that allows us to fill. And how we're going to gently fill these areas with Restylane. There's no anesthetic in the brow because there's anesthetic in this product. Are you comfortable there?
Mm-hmm. Yes.
Great. And now we're just gently layering the Restylane along the bone with this blunt cannula. So hopefully the risk of any complications such as severe bruising and bleeding will be very minimal, if any. Not impossible, but very unlikely. This is a significant advantage over what we previously did with sharp needles. And it allows the patient to be more comfortable and hopefully go on with a normal day. The swelling is usually minimal. You can see we're just gently going back and forth and layering. Comfortable here also?
Mm-hmm.
Right. I think that's enough. Thank you. Just want to show that. Ready? So now we've injected the left side, and you can see that this is immediately after we injected with Restylane along here. The small little access site is hard to see. There's really, fortunately, no bruising, which is fairly common. And you can see on this side we have not injected, and you can see that the depth of the eye is less deep, and it looks just more youthful because it's more full, and that's what youth is, it's more fullness. So now we'll inject this side to try and obviously match how that side looks. All right, we've completed our treatment now, and we've injected both eyebrow areas with Restylane. And this is immediately after. You can see we put a little drop of antibiotic ointment just to cover the tiny needle stick. This can be covered with makeup in an hour. There's really no bruising, although we'll give this nice lady some ice packs to use just in case. And she should be able to go out to dinner tonight without any issue. And this fullness is a little puffy and swollen, but that will go down. But you can see how it's just softened the entire appearance to the eyes.